right, good afternoon. Good afternoon. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I'm here to bring you a healthy and happy workshop on how to eliminate elbow pain. You can learn learn why your elbow hurts, how to get rid of that pain, and how to prevent it from coming back. I've been a physical therapist for over 25 years, and I got my doctorate from Mercy College in upstate New York in 2010. And I specialize in orthopedics and sports-related injuries. So today, I've seen a lot of complaints in the past couple months of people that have been playing racket sports like pickleball and tennis, and they've been reporting some elbow issues. And also, I had a golfer this last week that had golfer's elbow. So you've probably heard of the term golfer's elbow and tennis elbow. We're going to talk about what that all is. So let me get rid of that screen and then take it down to my two-shot. So this is the part that we're going to be talking about, the elbow. So typically, when someone says golfer's elbow or tennis elbow, it really doesn't matter. I mean, tennis players can get golfer's elbow, and golfers can get tennis elbow. It's really, golfer's elbow narrows it down to pain on the inside of the forearm. That usually starts on the inside of the elbow here, and that can radiate down into the inside of the wrist. The tennis elbow is the opposite side, where we get pain on the outside of the elbow, and that can go to the outside of the top side of the wrist. So the forearm and the elbow, we've got two bones here, right? So I have one bone going down the middle here on the inside of the arm, that's the ulna. And then we have another bone that goes down the outside of the arm, that is the radius. So the radius is small at the top and big at the bottom, and the ulna is big at the bottom, or big at the top over here, and small at the bottom over here at the wrist. So the rotation that happens in the forearm and the wrist happens primarily at the top of the radius, which is outside right here. So you could probably feel that around. If you look, you find where your elbow bone is, and if you just kind of slide it off there and you rotate your palm up and down, you could probably feel that bone rotating underneath your finger. All right. So we've got a couple of musculature, soft tissue issues that are, or muscles that we can talk about here. We have the flexors. If we kind of just think about all the muscles that flex the fingers and flex the wrist, pull it up like that, basically, they start on the inside of the elbow. And muscles that extend the wrist or extend the fingers the opposite way, they're all on the top part of the elbow, or the outside of the elbow. So a couple things that we could do to test whether or not it is a tendon issue or a nerve problem, because on the inside of the elbow right here, we have the ulnar nerve. And if there is any compression of that nerve, whether it's somewhere upstream of that nerve, maybe up into the neck, or downstream, that can cause some radiating symptoms like a numbness, tingling, and stuff like that. And to touch on carpal tunnel syndrome is where the median nerve gets entrapped right through here at the base of the hand. And that could be due to typically repetitive stress injuries with typing or mousing around, or tightness in the wrist or the palm muscle. So let's talk about how we can kind of tease out whether or not we do have a tendon issue. Tendon issues are tendonitis, which is defined as inflammation of a tendon that happens within 72 hours of a traumatic onset or whatever injury or pain. That usually goes away, the inflammation, after the 72 hours, and it is replaced by a condition called tendinosis. And tendinosis is when the fibers of a muscle, of a tendon, as a muscle inserts into the bone, those fibers become disorganized. So if we think about fibers and muscles, they need to be parallel so that they stretch and contract. They can slide on one another. Tendinosis is a condition where those fibers, especially the tendon, are disorganized. They kind of like are here and they're sticky, and they don't contract and relax or stretch and shorten very well. So that's represented as pain as you flex and try and resist that motion, especially in this position. If I did this as the classic one for tennis elbow, if we just lift the wrist and try and push that down, I get pain that lights up on the outside of the arm. You know that you might have some tennis elbow. And also just kind of opening the fingers up, that'll also elicit some of that pain on the outside. So what do we do about that? The first thing, let's pull this up, is we want to do some soft tissue mobilization. It basically boils down to stretching and massage. And there's a couple of different things that we could use. I've got a couple implements over here. One of the things that I like to use is this metal instrument here. It's made out of stainless steel. This is called a rock blade. It's made by Rock Tape, but there's a lot of different companies out there that make similar products that you can pick up online. It basically has different shapes. All the edges are beveled. They're not sharp, but we take that and we go over the tissue that might be stuck. So if you think about if I'm going to be treating something like tennis elbow, which is represented on the outside of the arm going into the back of the hand, I could just take this gently. If I wanted to, I can add some emollient or lotion to kind of free that up a little bit to allow it to be smooth or reduce some of that friction that I get on the skin. But for our purpose here, we're just going to kind of take that and then kind of move it around up and down over the tissue. And you can certainly go over the bony areas and right where it hurts, but you don't have to focus on where the pain is for this treatment to be effective, okay? So we just kind of take it, and I usually have people do it at whatever, a 60 degree angle, whatever they're using, their implement of choice, and at a 60-degree angle, move into the tissue slowly across that, all the fibers that would be painful on the outside of the forearm. We can go both different directions. And I usually recommend 1.5 minutes to 2 minutes of doing that up and down. We could also do the flexors on the inside of the elbow here, 60 degrees, just kind of pushing through there. If you don't have anything at home similar to this, I've had clients use a butter knife, just a handle of the butter knife or a handle of a spoon, something that is a little bit thin, but not sharp, not to create a lot of irritation to the skin or skin trauma. We're just looking at trying to get that tissue to slide, right? So as we contract and relax muscle, all those fibers and stuff, that soft tissue needs to move and slide on one another. We've got a lot of stuff on either side, and especially where the flexors meet the extensors, that little piece down the middle, we want all that stuff to kind of slide and move. And if you don't have one of these, that's fine. You could do it with your hands and your fingers. I like using my thumb just to massage that out. Now, once we prep that tissue, we could certainly go into a stretch. Simple, easy stretch would be to stretch out the extensors like this, and we take the hand and wrist and go down like that. We don't want to create a lot of stress or a lot of pain when we do that, but we want to keep everything relaxed in the elbow, straighten it out as much as we can, and then pull the hand down like that. So we'll get that stretch on the outside of the arm. Now, if you can kind of take a peek at my elbow here, I could turn up the intensity of the stretch by rotating my elbow down while I don't move my wrist. So that'll pull the attachment point up top here a little farther from where I'm stretching, and that's going to be a more intense stretch. On the opposite side, we could certainly just go the opposite way and just pull it down, keeping the elbow straight. Over there, we don't have to rotate that much away because there's not that much supination in this position. We're already supinated versus the other position where we're pronated. When we're holding a stretch, we want to hold it for at least 30 seconds. 30 seconds is the bare minimum amount of time to create a permanent change in the tissue. Another way to do that is to kind of do it with weight bearing. So if I'm going to take my table here, I'm just going to extend and push through here so I get that stretch. I can go around backwards here. That's a more intense stretch. I don't like doing the extensor stretch in a weight-bearing position so much because it creates a lot of stress on that wrist joint. So pick a version of the stretch that makes sense to you. Another way that we can do some soft tissue work on your own is with a lacrosse ball or something hard. So I can roll this out, similar to foam rolling on bigger muscles of the body. You can do this on all the different parts of the elbow to get rid of that pain, that knottiness, and that tightness through there. What I like to do, especially because the lacrosse ball is tacky, it has this rubber coating, is not only to create a rolling through the tissue, but also a shearing. So I apply that pressure into the tissue and I push. I don't slide or roll the ball. You can kind of, if you're doing this on your own, you can kind of feel how that tissue can slide and move a little bit, maybe about half an inch to an inch, and then it stops. And you could do that on different areas, figure out which direction and the location, which direction and where is it the most restricted in terms of the sliding component. We want to get through that area as well. This is a different method than just using the metal instrument. Okay, so the other thing that we want to talk about is preventing pain and symptoms from coming back, and that's where we have to go into some strengthening. So strengthening, and specifically if we're going to address the tendons as they insert on the outside and on the inside of the elbow, it's called eccentric strengthening. So I have a weight here that I'm going to use, and eccentric strengthening is the opposite of what we call concentric strengthening. A muscle, as it shortens, it will create a lift, and as it lengthens, it will lower the weight, right? So we lift the weight, that's typically concentric contraction. If we lower, that's called eccentric contraction. Eccentric contraction is when a muscle stretches out or lengthens under load. So I never want to do an exercise where I lift the weight with resistance. I want to only lower the weight. So the easy way, especially for this lateral epicondylitis, is, I'm going to hold this in my other hand. This is the elbow that I'm going to be working on. I'm just going to put my hand in this position, and I'm going to place the weight in my hand, hold it for a second, and then lower slowly. The time that I want from the top to the bottom of the motion, I want that to be about 6 to 10 seconds. So it's pretty slow. And then when I get to the bottom, I let go of the weight, I hold it in my other hand, and I lift that hand again, I place it in there, and I lower slowly. The more weight you use and the slower you move, the more effective it will be at strengthening that tendon in the long term. Now, all things said, this type of exercise is probably the most noxious or targeted to the tendon itself. So I wouldn't do a lot of reps. Like a lot of exercises that if you go to the gym, you might do sets of 10 or 12 or 8, and then multiple sets, right? So I'll do 8 times of this exercise or 10 times of this exercise and rest a little bit, then I'll do like 3 or 4 sets. For this, the maximum I would do is like 8 times in just 1 set, because you could always lower more weight than you could raise. And typically, when we do something like this, I don't want it to hurt. So if you think that you're doing an exercise and it hurts so good, more is better, it's not. Because we want to create more strength in the tendon, but not to a point where we irritate and exceed the tissue tolerance and then kind of fire it up again, and then the process kind of restart, where there's pain and we don't get rid of it, and then every time that we use it, it lights up and it gets hurt, it gets painful. And that's the tough part with working with elbows, because we're always using it, especially if it's your dominant side. We want to be able to allow that tissue to rest and to have that tendon recover. And this is how we strengthen it and make it more durable. So again, eccentric motion here, I just hold it at the top and then lower slow, 6 to 10 seconds, all the way to the bottom. I might get a stretch at the bottom, and then I remove that. You can also do this in a manual version, or just use your other hand as resistance. So I'm going up, no resistance, and I apply pressure with my other hand, and I'm pushing down, and I'm doing that slowly. So there's certainly a lot of different ways that you can apply that tension on the lowering phase with a band or a weight or with your hands. If you wanted to do the flexors, you're having, say, golfer's elbow, it would be coming up like this, just holding that position with the weight and slowly lowering. So again, you could always lower more weight than you could raise. This should be totally pain-free. You want to pick a weight that is quite heavy and that you couldn't lift by yourself, but you could certainly lower by yourself, okay? So eccentric strengthening, and there's a couple other positions as well, like because we talked about the radial head in the beginning and how that rotates, if that pain is on the outside, I definitely want to address the ability to pronate and supinate my hand, rotate palm up, palm down. So I can go through the same type of principle of eccentric strengthening that we just did. So I'm going to start in that neutral position. I'm just going to hold this. I'm going to slowly lower it to the palm down position. So I should feel all that tension on the outside of the elbow like I've done before. And I release at the get to the bottom. I raise without the weight, and I lower with the weight by itself. Okay, and I release. I do that again 5 times. 5 to 8 times is probably recommended for this. And then we could always do the opposite way, right? Supination. I'm going to hold it vertical, and then I'm going to slowly let that rotate to the opposite side, palm up. And again, when I get to the bottom, I don't lift. I only lower with the weight, eccentric strengthening.